and probably physical abuse and other forms of abuse at the same time. So because similar things apply to all forms of abuse. And we can give more information about that then. But it's very important that a person does not feel that they are to blame for being abused.
Yeah.
A very basic fundamental truth. You are never to blame for being abused.
Yeah.
Ever.
Our next question is from Miranda. And it's a little lengthy, so I'll read through it
Sure.
and
then we can discuss it.
Yep. She says, I'm reading an excellent book called Healing Developmental Trauma, How Early Trauma Affects Self-Regulation, Self-Image and the Capacity for Relationship. In part 2, it talks about how the traumas of neglected basic developmental needs and abuse affect the brain, endocrine system, chemical balance, etc. It cautions therapists to take the patient slowly through their healing process, especially when there has been severe traumas and abuses. From what I have read in a few similar books, John Bradshaw's Homecoming included, they seem to be missing a point between understanding how the soul damage is created and the healing, or so how the healing takes place. With psychotherapy, it seems to take a long time and many sessions for people to become healed. From my experience, when people's, mine included, causal emotions are truly released, the law of attraction changed almost instantly, within 24 hours sometimes. Would the chemical imbalance be corrected as rapidly as a result of this deep healing, or would that take time, as creating synapses or grooves in the brain usually happens over time? And if it is not happening instantly, how could the transformation still happen with no relapse? In the case of a person who went through repentance, how lasting would the change be? I noticed that when repentance happened, the changes are much more profound. Is it safe to say that there's no need to concern ourselves with the chemical imbalance and simply trust that a person will go where they need to go in their emotional processing to the degree of their desire to feel?
Well, I feel this is a very good question, Miranda, and as a therapist, she's a therapist, I know, so she's got quite a lot of background about therapy, and she's seen the positive benefits of applying the principles of how the human soul functions to her own therapy. So I think we need to probably dissect this entire question.
Yes.
So let's do that.
Okay. So,
firstly, she talks about a whole series of books, some of which are well known, regarding the effect of trauma in your childhood and how it affects the physical aspects of the regulation of your brain, your endocrine system, your chemical balance, and even your muscular and skeletal systems. And it does affect all of those things.
yeah.
So yes, all of this early childhood trauma does affect your entire body, of course, because it affects your soul, and your soul is connected to your body. And so everywhere there is a blockage of some emotion, and usually inside of a person who's experienced trauma as a child, a lot of trauma in particular, and if it's been, systematic trauma, like usually sexual abuse is, then of course there are going to be lots of different areas of blockages inside of the soul. So in other words, there's going to be energy locked up inside of the soul in lots of different areas of the soul, which will then reflect in the spirit and physical bodies. So you're going to have all aspects of your physical and spiritual bodies being affected. And because most of this trauma occurred during your developmental years, from the ages before up to 7 years of age, it means that many of these are belief systems that are well established inside of your memory, and therefore also well established inside of your brain in terms of how your brain works even.
Yeah.
So all of these things, of course, are true. They're all true, and they've been proven, I feel, scientifically at this point in time to be true.
Yeah.
The problem where it all goes awry is where we start attributing certain potential causes to these effects. And this is where I feel the medical profession goes out of harmony with the development of scientific fact. We can only make statements of scientific fact, or we are just basically, wandering around in the dark. And I feel a lot of the times what happens with scientists and the medical profession is a scientific profession, is they measure a whole series of effects and then they postulate as to what the causes may be, rather than knowing what the causes are. Now, once you start to understand how the human soul functions, you realise that everything that's happening in the physical body is about the denial of something that's happening in your soul.
So everything negative or unhealthy that's happening in the body?
Everything.
Yeah.
Everything, including negative belief systems, are all the result. They're not the result of chemical imbalances in the brain. They cause chemical imbalances in the brain. So the chemical imbalances in the brain are the effect of these soul-based locked up emotions, not the other way around. And these soul-based locked up emotions cause physical problems in the body. They cause also physical problems in the spirit body. They cause problems with the flow of energy. And anybody who's used to any kind of Eastern or Chinese type of medicine would know that emotions prevent the flow of certain spirit that they can see in the spirit body, prevent the flow of energy in the material body. So therefore, the material body gets affected by, and therefore not only affected by, but unfortunately harmed by the locked up emotions. Now, they also know, many people in Eastern medical professions know, that there is also the attraction of entities. They call them entities, not spirits, people, but they call them entities from what they call other worlds or whatever, but really they're just spirits who are attracted to these particular injuries, who also exacerbate the problem for the person who's gone through these particular traumas. And many times these people have influenced the people on earth, these spirits have influenced the people on earth during the developmental years of their life. And that, of course, also then means that they are greatly influencing the flow of energy in their body as well.
Yeah.
So we have all of these combined issues and problems. Now, to then assume that we must go slowly and be careful and all of these other presumptions, there's now no scientific evidence for those presumptions, right? There is a lot of anecdotal evidence, because most people who have had trauma during their childhood experience have a lot of deep resistance to experiencing the emotion. Most people who experience childhood trauma want there to be another solution other than feeling their childhood trauma-based emotions.
Yep.
So they are in a mode already where they want to avoid the experience of these emotions. Since they want to avoid the experience of these emotions, they often are overcloaked or influenced by spirits during the processing of these emotions. As a result, the therapist measures that avoidance through the psychotic, if you like, episode that the person who's going through the emotion might have experienced, and the therapist becomes very concerned and therefore says, we need to be very, very careful, we need to take it very slow. But that's without a complete understanding of what's going on. And unfortunately, there are no scientific or psychological journals on the planet today that actually know what's going on in a holistic picture of what's going on, particularly for early developmental trauma, but for all forms of trauma, actually. And because we don't know, because nobody knows, they're all very frightened, and therefore they want to take a lot of very, careful consideration. And that, of course, means that there is a very slow process of recovery, if any recovery at all, that many of these people who have experienced childhood developmental trauma, many of them never recover their entire life, or they find their life difficult for most of their life, unfortunately. It doesn't have to be that way. But to not be that way, it requires understanding the soul. And this is where I feel every single person who's doing therapy needs to understand how the human soul functions. And we've pointed people all the way through these discussions about emotions, we've pointed them to the series about how the human soul functions. It is an essential piece of material for any therapist, psychologist, psychiatrist, any person who's involved in therapy, any life coach. All of those people involved in those industries need to examine how the human soul functions if they're truly going to have a positive effect on a person. Now, Miranda then raises the issue of what happens in her experience. And what she has found is actually true. And that is that you don't have to concern yourself about going slowly at all. What you need to concern yourself with is the willingness of the patient to actually feel the emotion that occurred during their trauma. Most patients are unwilling when they begin. Now, because they're unwilling when they begin, because they're afraid of their emotions, they're afraid of how traumatic these emotions are, and so forth, there is a high likelihood, particularly at the beginning, that if you take them through a process they are unwilling to follow, that they will withdraw from the process and during that time become overcloaked by spirits who get involved in the process with them. In other words, there's a higher likelihood of them reverting to psychosis or psychotic behaviour during that period of time.
Right.
If the patient's completely willing emotionally to experience their emotions, there is no danger at all of that occurring. And if they allow the emotional experience, as Miranda has found during her own therapist sessions with other people, they will release the causal emotion and their life will instantly demonstrate the change. Now, it's instant. Now, even though most people only observe it over 24 hours or 48 hours, it's actually an instant change that's occurred in the soul. Now, from that moment on, any physical or psychological or intellectual impairment that has occurred due to that emotion that has been locked up all of that person's life, during their life, all of that, any of that impairment related specifically to the emotion that's been released will also begin its recovery.
So it's not instantaneous, but it begins.
Well, there are some systems in the body that are instantaneous or relatively instantaneous that will occur over the next few hours. Does that make sense? Then there are other systems that take days. There's other systems that take weeks, some take months, and some take up to 7 years. So it just depends on which system we're talking about as to how long the recovery will actually take.
Clarifier. So Miranda, in her question, poses that if this takes time, isn't there a danger of relapse? Because, and this is where she's viewing the physical body as the thing that is directing how the emotion flows.
This is because of a misunderstanding about the soul. Everything comes from the soul. So there is no danger of a relapse unless the person imbibed the same emotion that they had, and the likelihood of them doing that is very highly unlikely. So there is highly unlikely they will relapse.
So when we release something causally, the change happens in our soul.
Instantly.
Well, perhaps we should rewind and recap what you said. You said as a child, things are, when there's trauma and that's suppressed, things are retained in the soul.
As energy locked up.
They're
not being felt as emotion. They're just energy locked up, not in motion.
And this affects the spirit body and the physical body. So the cause of any issue is in the soul, and that's reflected in the spirit and physical body. So these things that she's talking about the endocrine system,
chemical balances in brain, the synapses in the brain, the way you think. The way you think even is completely changed.
The formation of the brain.
The formation of your cells, the damage done to each individual cell in different locations, the different problems you have in different parts of your body. All of these things are the subsequent result of the suppression of the emotion from the child.
So they are the effect. They're not governing what happens to the emotion. They are the grooves, if you like, that are formed because of the soul's decision to deal with the emotion in a certain way.
Yes, and because they're not governing, because they are the effects, they have no governance over the recovery.
Yes. Once we recover the soul, then even though the grooves in the brain that she refers to, or the functioning of the synapses, might still be in a certain way, because the soul has changed, this will gradually create the change in the brain. But the brain is not going to dominate the soul.
No. And many parts of your body change very rapidly, usually within the first 24 to 48 hours.
Yep.
And so you will have a large benefit that you will feel in your body, usually within the first 48 hours. And then there are other systems in your body that take much, much longer to recover. And so therefore will take a longer time, and you'll need to drink a lot of water and do things to help your body do that, of course, because there's a lot of toxins now that are going to come out of your body. A lot of your body's systems will begin operating correctly.
Yes.
And as a result, they'll start repairing this long-term problem. And of course, any long-term problem has a build-up of long-term issues inside of the body that need to be repaired. And that repair process may take anywhere from hours to years.
Yeah.
Anywhere up to 7, in fact, years, depending on what system you're talking about. Now, all of what I said applies unless you've received divine love. When you receive divine love, and particularly once you become at one with God, all of your systems in your body are automatically in harmony with that love. So this is how a person who's a healer, who is at one with God, so there's no one on earth in that condition at the moment, but a person who is a healer, who is at one with God, can instantly heal certain parts of the body once a person is willing to experience certain emotions associated with the injury in that part of the body. Mm-hmm.
So you're saying, whereas we might, through our own will, decide to feel those emotions, release them from the soul, and there'll be a gradual change in the physical body.
Yes. And when I say gradual, it may be gradual hours right the way through to years.
Yep. When a person who actually heals using divine love, then we still must be willing to release the emotion. And if we do, then the changes in the physical body are instantaneous.
Yes, because God's love is able to be used as the healing mechanism of the systems affected by that particular emotion. Mm-hmm. So this is how I healed things in the first century. And this is how anyone who becomes at one with God can heal other people.
Yeah.
Of course, there needs to be a willingness inside of the person to address the underlying emotional issues. And that's where most people, that's why we're spending this time on emotions, because we need to help people come to accept the importance of working through and addressing their emotions in terms of even somebody else coming along at some stage in the future and helping them be healed.
Yeah, yeah.
There needs to be internally a willingness, you see, and her last statement, I feel, is the important statement. So maybe if you read that again.
Is it safe to say that there's no need to concern ourselves with the chemical imbalance and simply trust that a person will go where they need to go in their emotional processing to the degree of their desire to feel?
Correct. That is correct. The person will go where they need to go in their processing, directly proportional to their desire to feel. And this is where therapists can help a person greatly. It's about attempting to help the person understand the way the soul works and the way the physical and material body, the physical and spiritual bodies are affected by the soul. So this is a way you can educate people as a therapist. But also the primary education that needs to occur from the therapist to the patient is the education about their will, the exercise of their true desire to feel. Mm-hmm. And many people, as I've said right at the beginning of this answer to this question, many people who have had early childhood trauma have very little desire to feel it. And this is why so many damaging results occur when a person goes to a therapist, because they're actually in this lack of desire to feel it still. They want their life to be fixed without having to go through the feelings. So they want some kind of chemical solution, medical solution, some therapist to wave their magic wand and come up with a solution, but they don't want to have to go through the emotional experience.
Yeah.
And this is the primary problem that causes things like psychotic behaviour during the process of trying to help a person through traumatic memories.
Yeah.
So what I'm suggesting to people is if you can, it's not good to push the patient into being willing to do something they are obviously not willing to do. But you can educate them about their willingness and the need for them to develop a willingness inside of them. And will is like a muscle that needs to be exercised, as we'll talk about many times in the future.
Yeah.
And so what we need to do is help them see that they can develop their will and grow their will to start to experience and release many of these emotions that they are now safe to experience, even though they weren't safe to experience them as a child. And once you do that, there is little danger of them, and no danger, in fact, at all, of them ever being harmed by spirits or some psychotic episode, which is usually triggered by spirits in some way, through their therapy process. And so that means that people don't have to worry about how fast it goes.
Yeah.
How fast it goes will be dependent completely upon the will of the patient.
Yeah.
And that's the way it should be, in fact. And what we can do is help the patient have a developed will. So they want to go through it rather than looking for some magical solution to the problem.
What are the original causes of fears and terrors that now seem to dominate the planet?
Well, the answer to this question is